Hi, I'm Dr Anthea Rhodes, paediatrician here at the RCH and your host today on the Kids Health Info podcast. In our current series, we're talking about things that we commonly see in our emergency department. And perhaps one of the most frightening things that a parent can experience is something called a febrile seizure or febrile convulsion. To talk to us today about what's really happening and how parents can manage this, we've got one of our senior emergency department specialists, Dr Sandy Hopper. Welcome, Sandy.
Thank you.
From the Royal Children's Hospital, Melbourne, this is the Kids Health Info podcast.
So, febrile convulsions, or people might understand the term better as seizures. Tell us a bit about what these are and perhaps when you might see them in the ED.
This is a very common presentation to our emergency department. This is a young child between, say, 6 months and 4 years of age, has a short seizure. It's sparked by a rapidly rising temperature. It often comes out of the blue and is one of the most frightening things that parents can ever see.
One of my first shifts in the emergency department a long time ago now, a parent came running in. They lived nearby to the hospital and had actually run across the road. Dad was still in his pyjamas carrying his child in, terrified that his child might actually be dying. And I think that's often how parents feel when this happens.
I do ask parents how they feel, and they often open up and say they thought their child was about to die today.
Yeah, okay. So tell us what is actually happening when that seizure occurs and what we can do to prevent it, if anything at all.
A seizure is a sudden change in the electrical impulses in the brain, so the child loses consciousness. They can become stiff or start shaking, their eyes can roll, their breathing is impaired, they're not particularly able to maintain their airway. That's what a seizure is in general. With a febrile convulsion, it's sparked by a rapid upswing in the temperature, usually in the context of a benign viral illness. So it comes on out of the blue, the child suddenly becomes stiff, loses consciousness, and then starts shaking. They're foaming at the mouth, and that can last for usually a few minutes, not often longer, and then the child is dopey or drowsy after that, not really speaking, and over a period of, say, 15 to 45 minutes slowly wake up and come back to normal. On the issue of preventing febrile seizures, you can't, and that is something that's hard for parents to digest, I suppose. The temperature in the body swings up and down in a natural and healthy response to infectious diseases. And when the temperature is rapidly rising, the paediatric brain, the young brain, is sensitive to that sort of stress, and that can spark off a seizure. About 1 in 30 Australian children, we think, have febrile convulsions, and they do grow out of it by the age of 4, 5, 6, something like that.
Okay, so lots of detail and information there. What I might do is go back and unpack a few of those different aspects one by one. So if we go back to thinking about what it might look like when a child has a seizure, can you talk us through that specifically first?
The child will change abruptly from normal, or probably a bit grisly, a bit drowsy because they're hot and bothered, to suddenly becoming stiff. A sudden change in their alertness. The eyes of the child will often roll up, and typically the first phase of a seizure is a tonic phase, which is a very stiff phase. So the child might suddenly become stiff and their eyes roll. After that, there's often a clonic phase where there's rhythmic shaking of the mouth, face, mouth, limbs, and that can go on for a few minutes. When the seizure stops, there's no more movement. The child usually looks like they're asleep.
As you can imagine, and with you describing it there, a really frightening thing for parents to see if that happens. Can you tell us a bit about why it comes on in the first place?
We know that some children are prone to it. It does tend to run in families, and sometimes we, when we're talking with families, the nana pops into the room and says, "Well, you had it when you were a child," to the parent. So there is a genetic component to it. It is related to the sensitivity of the child or paediatric brain to any stress, to be honest. But fever, rapidly rising temperature is one of the big stresses.
And so you've mentioned this is when a child has a fever, because of course children can have seizures for other reasons without a fever, but we're not talking about that today so much. We're going to focus on those seizures with a fever. So does an episode like this mean that that fever is part of a really serious illness?
Usually not. So any cause of fever in a child can cause a febrile convulsion, and most, if not the overwhelming majority of fevers in our community are from benign viral infections.
And can you tell me what you mean by benign, Sandy?
So benign means it gets better on its own with supportive care and doesn't cause any long-term damage. Most commonly it's a common viral infection, cough, cold, runny nose, gastro, those sorts of things. The body, in fighting that infection, puts the temperature up. That boosts the immune system. And as a side effect of that, the rapidly rising temperature can spark a seizure. Very uncommonly, seizures with fevers are from more serious things like brain infections, and we're always on the lookout for that, but that would be a, thankfully, rare thing.
So in the event that a child does experience a febrile seizure, what should a parent do?
First thing to do is to put the child on their side in a safe place, which is usually the floor. It could be a couch, but we don't want any injury to occur from the child from their rigid and shaking behaviour. They're not able to control their body, so we don't want them to fall off a bed or a chair. Putting them on their side means that any secretions that are coming out of the mouth can pool and fall out of the mouth. If they're on their back, the secretions can go backwards and into the lung. So placing them on their side in a safe place. Second thing is to check your watch, ideally start a stopwatch. Third thing is to call 000 to activate an ambulance coming towards you. The ambulance service and operators will provide some advice to you because it's hard to keep calm in this situation. And the ambulance carries medications to stop a seizure in the very rare instance that the seizure goes on for too long, say 10 or 15 minutes.
And sometimes, Sandy, people think about maybe trying to film something when it's happening because they want to be able to share that information. What's your advice on that?
Yeah, look, that could be helpful, though I'm mindful that you've got the rescuer, the parent, has a lot of things on. So I think the best thing to do would be to start the timer on your phone, put the phone next to the child's head so that you can then provide good positioning with your hands and also see the time. If there is someone nearby who has the presence of mind to film it, that can be helpful for us, but usually febrile convulsions are quite typical and recognisable, and we don't necessarily need footage to diagnose them.
Okay, great. And what about putting things in the mouth? I think that's one of the other, misbeliefs out there, that people think that might be helpful.
Yeah. I mean, that's historically based. That has been in guidelines in the distant past, and you do see it in Hollywood as well. But the problem with putting something into the mouth is that you can cause injury either to the tongue or the teeth or your own finger, and it doesn't really improve the airway. The only exception is if there's a large object in the mouth, just say there's a big chunk of food and you can see it, by all means remove that. But for the rest of the time, placing the child on their side and letting the secretions and bubbles sort of flow out is the best way to make that airway as good as possible.
So it is a very scary thing to see, as we've talked about, Sandy. And one of the other things parents worry about is whether or not their child will go on to have brain damage as a consequence of having experienced a febrile seizure.
Yeah, that's a very common question. And the good news is that no, febrile seizures do not cause brain damage. The child's long-term development, intelligence and outcome is not altered by having a febrile convulsion.
And obviously we've talked about the fact that the temperature of the child is part of this picture. It's often going up or already high. Should parents be trying to cool their child down when they're having a febrile seizure?
Not actively. We would want parents to strip the child down to, say, a singlet, so that the child's body can take care of the temperature themselves by sweating and just letting the heat blow off, so to speak. We don't recommend placing the child in a cool bath. We don't think that ice applied to the forehead or under the arms is helpful. The body's thermostat will do its own thing, and to strip the child down to give their body the opportunity to do it itself is good. We have seen misadventure with people putting their children in ice baths, so we don't recommend that.
And particularly if your child is not conscious or experiencing a seizure, that could be potentially really dangerous.
Yeah. And to drop the temperature to below normal levels can be dangerous for a child. A dose of paracetamol or ibuprofen, once the child is awake enough to be able to tolerate that, would be helpful, can help the temperature come down, but isn't something that's going to switch the temperature off. It will certainly make the child feel more comfortable, which is helpful when they're waking up. You want to see how they're going.
Okay, great. And one of the things that I know worries parents if they have experienced this with a child, they want to do everything they can to make sure it doesn't happen again. Yeah. So that might be to that same child or perhaps to a sibling. Parents can become really quite sort of vigilant or worried about this happening again. What advice have you got there?
It's natural to never want that to happen again, to never want to see that again. The blunt truth is that you cannot prevent a febrile convulsion by aggressive fever control or fever monitoring. Chasing a fever down with extra doses of paracetamol or ibuprofen, stripping them down, putting ice packs on, putting them in cold baths, will not prevent a febrile convulsion. It either will or will not happen. So my advice is for parents to be aware and able to manage a seizure if it does happen. The good news is that the recurrence of a febrile convulsion is less than 50%. It's usually in another illness in the future. So parents can be somewhat reassured that it's not going to happen again. And we certainly don't want parents to become, if you like, fever phobic or super vigilant. It's hard not to. I think it's an emotionally hard journey for a parent to go home with the proposition that their child may well have another seizure in the future, and there's literally nothing they can do about it to stop it happening. So I do try to give parents the confidence that they can manage the seizure when it does happen in the future. So
having that plan and preparation and perhaps for other family members too who might be caring for the child, making sure they're comfortable and knowing what they can do or need to do in the very rare case that it might happen again.
Yes.
So all of that's really important and helpful advice, Sandy. Have you got any final tips or, I guess, parting words that you would like to share with parents if they've had this experience perhaps before or they're worried about it happening to their child in the future? I'd
certainly validate parents in that this has been one of the worst days of their life. That is incredibly frightening. I would say that the worst of their day is over because the seizure has resolved, and I would turn their mind to caring for their child with the fever and the likely viral illness that they've got. And arming them with the tools to be prepared if a febrile convulsion or febrile seizure happens in the future.
Thank you so much, Sandy. It certainly is a really worrying thing for parents, but great to have that advice and a bit more information to help them understand what's going on and some reassurance that this is something that their child should grow out of into the future and it's not going to have any long-term consequences. Thanks so much for coming in to chat to us today.
Thank you.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.